do you notice any bleed?
No,
Okay, good. And you never had any like heavy bleed in between your menstruation?
no.
That's, that's good. And by any chance, have you noticed any ever skip your menstruation period when you started your first time menstruation?
Okay. My very first time menstruation,
Yes.
it was like 15 years when I was 15 years.
All right. Thank you very much. And one more thing I would like to ask, that are you updated with the pap smears?
Yes, I am.
Okay. And by any chance, you're planning to get pregnant?
No.
Okay. Well, thank you very much. So these are the questions what we need to ask for the periods. Now I'm coming to the sexual history questions. Okay, Lita. Now I would like to ask few standard questions about your sexual health, and we usually ask everyone having the same problem. Is that okay with you?
Okay, yes, sure.
Thank you. May I know, are you sexually active?
Yes, I am.
Okay. And may I ask, do you have a stable partner?
Well, is it necessary to answer?
That is a bit important, as I mentioned that again, I want to reassure you. I want to tell you whatever we will be discussing is 100% confidential until we need to get help from our seniors. Okay. And one more thing I would like to reassure you, we are trained to ask these questions and it's very relevant to your condition.
Well, I have a stable partner.
And how long you been in a relationship with your partner?
Last year.
Is your partner male or female?
Female.
Female partner. Okay. And how old your partner is?
Same age as me.
Okay. Yeah. Good to know about that. And you're having a good relationship together.
Yes, I am. Yeah, we are.
Know that. And before that, before your this female partner, did you have any other partner before? Or you have any?
No, no,
You currently having another partner? No.
no.
And by any chance, before 6 months or during that 6 months, have you ever had any male partner as well?
No.
No. Okay. Few questions about your sexual preferences with your partner. What type of sexual activities do you perform?
Well, everything, I guess.
Okay. By that I mean, do you do oral or do you use sexual or share sex toys as well?
Yeah, we did.
Okay. And have you ever been, both of you ever been screened for any sexually transmitted diseases?
No, why I have to? We are lesbian. We don't take any guys.
Okay, no problem. I'll come back to that. And a few more questions about your sexual history. If you would like to share anything regarding that, any discharge from your private part,
No.
right? And that's it. Thank you very much for answering all those questions. Right.
Yeah, thank you.
These are the different ways you would ask sexual history from the female. When you are taking sexual history from what I have missed in female sexual history, man. Aliyah,
You asked about period.
yes.
Okay. Because I'm like dating a woman, so I don't think like like maybe you can ask about sex toys like do I use condom?
Sorry.
Like you asked me about like sex toys, oral, we use everything. So
But
maybe during that time.
I asked about the male partner. You said no. So why
No,
would I
no. You have to ask because sex toy, you have to use condom, otherwise the fluid.
Oh, okay. Oh, yes, that's a good question. So I can ask that by any chance, do you use condom on sex toys? And do you,
Yes.
right? Yeah. Thank you
Yes.
very much for adding that. What else I could have asked? Right, well done. So these are the questions for the sexual history. Now we'll be moving to one by one with the different sexual history questions. So May, you have to try one scenario on which a male coming with the problem, a male coming with the personal problem. So we're starting with for the male health. I'm going to tell you scenario now, and you have to repeat that. And it is nowadays getting very common scenarios favorite by examiner, because what they would they want to see that how would you deal these type of scenarios, because these are common scenarios in GP setting, and you might see some males coming with personal problem. I won't tell you what is my personal problem. So it would be you have to find out what personal problem I'm going through. I'll put 8-minute timers now. 8-minute timer. After that, I'll tell you approach for that scenario. I'll tell you different scenarios, in what way those scenarios can come. And I would do as well if needed, if Maya perform 100% well, so I might not need to do. Okay, so because Maya is very good in doing all of the all of the scenarios which are very sensitive. So I am 55-year-old male. I am 55-year-old male. I have some personal problem. So you have 8 minutes and you have to resolve my personal.
Okay.
And I have requested, I have to do one important thing. So I'm going to put on the timer. Guys, please turn off your mics. Mute your mics, please. So the personal problem could be anything. Okay.
Okay.
I'm 55-year-old. Can you repeat scenario? Then after that, you would start.
55-year-old male come to the GP clinic.
Okay.
Okay.
That's it. Start. Michael
Into the
down.
room.
Hello, I'm Dr. May, one of the FY2 doctor in this GP clinic. Could you please confirm your full name and age?
My name is Michael Brown.
What would you like me to call you?
You can call me Michael.
Well, Michael, how can I help you today?
Doctor, I requested a male doctor.
Oh, I'm so sorry that I have to tell this to you right now. The ward is a little bit hectic. Would that be all right if you can tell me your concerns so that I will try my best to help you?
It's personal, doctor.
I can see that you feel uncomfortable, but I would like to tell this to you. As a doctor, we trained to handle in every scenario. And as well as, the following conversation me and you will have will be confidential between you and me. Would that be all right if you share this with us?
Okay, doctor. Yeah, thank you. I have problem down below.
Okay. I can see that you have some problem with it. Could you please tell me more about that?
Doctor, I'm having problem getting hard.